Unit-3, Part Q. Today's topic, antenatal exercise. Antenatal exercise is nothing but the exercise that is performed by the women at the time of pregnancy. What are the benefits and the uses of antenatal exercise? See, at the time of pregnancy, if the woman is performing exercise or doing some kind of body stretching activities, it will be helpful for the women to reduce the pain like backache, cramps, hip pains, leg joint pains, everything will be reduced and the body posture will get improved. It reduces constipation. Constipation is a general problem or the minor problem that is seen in the pregnant women. Exercise will reduce it. And other minor problems like stiffness, body aches, constipations, insomnia can be reduced by doing exercise. And even by doing exercise, our muscles get free and comfortable and it will get prepared for delivery process. By doing exercise, our stress level and anxiety level will get reduced. If the stress and anxiety level is reduced, then automatically the insomnia which is present in the pregnant woman will be reduced. In the sense, the mother will get a good sleep, a healthy sleep. A healthy sleep indicates a healthy baby. These are the benefits of antenatal exercise. What are the common exercises that need to be done at the time of antenatal period? That is nothing but abdominal exercise, pelvic floor exercise, circulatory exercise, breathing exercise. See, in abdominal exercise, you can see the transverse exercise, which is quite common. That is, you should get kneeled as shown in the pic. And then you should move your lower part like the abdomen. You should move your leg and spine. That is considered to be the abdominal exercise. And next, pelvic floor. Pelvic floor exercise is one of the main exercises which is done during the antenatal exercise. To support the pregnancy, pelvic floor exercise is very important. In that, Kegel exercise is the common one. You have to first lay on the ground and then lift your abdomen region as shown in this pic, and you have to hold it for at least 10 seconds or 5 seconds is also okay. You have to lift your abdomen by inhaling and then hold it, and then you can get back to the normal position by exhaling. This can be done either morning and night. This is Kegel exercise. Circulatory exercise is nothing but the exercise that is performed to the leg, mainly for the circulation of the blood. Next, breathing exercise. Breathing exercise is nothing but you need to sit straight and breathe in, breathe out slowly by inhaling and exhaling. And you have to do it repeatedly twice or thrice a day. Warning signs or the stop sign. This is nothing but if you see this sign or if you see this condition, you need to stop doing exercise immediately. That is, if you see any vaginal bleeding, if you see any bleeding from the vaginal area, you need to stop doing exercise and consult the doctor. If you feel more fatigued, like if you're feeling like you're almost going to fall on the ground, if you're feeling like that, if you're feeling very dizzy, you need to stop doing exercise and consume more water and other kind of energy drink. And if you have problem in breathing, like shortness of breathing, you need to stop doing exercise. And if you get any chest pain or abdomen pain, you need to stop doing exercise. Headache. If headache is getting worse by doing the exercise, you need to stop it immediately. Muscle weakness, you're not feeling strong, you're feeling very, very weak, then you need to stop doing exercise. Any pain or swelling, at the time of swelling, nobody is going to do exercise, so no need to do exercise. Uterine contraction. If you feel any kind of uterine movements or uterine contraction, you need to take the rest and please don't do the exercise. Decreased fetal movement. Yeah, even if you doesn't feel the regular fetal movement, you are not supposed to do the exercise, because by doing the exercise, you are making the condition more worse. You need to consult the doctor immediately if you're feeling the fetus is not moving as usual. Fluid leaking from the vagina, like either vaginal bleeding or fluid leakage, you should stop doing exercise. You need to visit the doctor. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video.